Thank you, Maria Rosa. Thanks a lot for having me here. It's an honor and it's a great experience. I'd like to keep it high level, more philosophical, with a little bit of overview. And the topic itself has been a hot topic for us as a company, especially starting last year. There's been a lot of increased demand in this. There's been a lot of interest. There's been a lot of request to do something in the healthcare. So a few words about our thoughts on the topic. Now, just as Industry 4.0 has the customer be at the center of attention, and the Health 4.0 aims to direct the innovation efforts towards the healthcare becoming more personalized and bespoke. A trend that will at some point be optimized around all different specialties of healthcare to enable new fascinating field that we can call precision medicine, which is completely data-driven. The rise in importance of the digital health initiatives in our society goes beyond simply facilitating the data collection and streamlining services and operations. It's rather digitalizing the industry also allows for creation of a distributed market for data. A market that will permit patient records and history to be instantly accessible by the medical institutions within and across the EU, while maintaining full compliance for confidentiality and data protection rules, potentially making EU a leader in a data-driven healthcare. These large data lakes can be algorithmically analyzed to the extent that will allow real-time assessment and even prediction of the health trends in any particular region, and also taking various demographics into account, which is extremely important, which can be a major driver for designing healthcare policies in a way that would address the bottlenecks based on the historical and forecasted dynamics. One example of these kind of benefits coming from a vast data sample pools is from Taiwan. There was a fascinating study analyzing database health records of nearly 800 million patient visits. And it managed to identify previously unmarked cancer disease associations across genders and ages through early detection of cancer comorbidities. Now, the more interlinked data there is available for analysis, the more accurate and effective predictive algorithms become. As a good example of an existing, more recent initiative in this kind that is connecting the national health system across multiple European countries, it's OpenNCP, which is already supported by the European Commission. And however, despite very high levels of technology access and computer literacy across European nations, many clinics and hospitals still do not fully implement these digital technologies into their environments. Facilitating this change would require strong leadership on the EU level and clear guidelines, very importantly, detailing this transformational journey. So there has to be two pillars, both leadership and underlying processes. Another very important point to make, over the past few years, a large number of doctors and clinical staff across Europe have been subject to burnout. They've been on the brink of exhaustion. And the trend is even more apparent in clinics that specialize working with underprivileged demographics. And that has been exacerbated over the past 2 years due to the pandemic, obviously. A lot of the time of the staff, a lot of their time and energy goes towards collecting patients' history, track records, updating both EHR and their internal CRM systems, which also significantly limits both the effective visit time and the quality of the provided services. Basically, poor data collection and recording is causing staff burnout and puts significant strain and pressure on the healthcare system. In order to improve healthcare sector's effectiveness, it is essential to redistribute the efforts in a way that will allow healthcare professionals to provide maximum added value while largely automating administrative activities. Simply put, less time should be wasted on the form filling while enabling patient-centric service design and maximum time allocation towards the actual care. It's also important to mention another concern that arises when connecting a vast number of people and countries and having to store sensitive patient information, and that is, to the Wayne's point, its security and anonymity. Now, this is in part addressed by the General Data Protection Regulation, which emphasizes the importance of capturing informed consent from the patient in order to share their information. And while being a powerful tool that protects individuals and sets a framework of ethical standards, it can also be a significant bottleneck in a large-scale rollout of the digitalization initiatives. And again, addressing this would require training, would require leadership in the places. The right way to address and solve this is through high-level EU-level leadership, educating all TISA stakeholders, giving them understanding about not only compliance procedures, but also providing full visibility and clear framework on how to implement these initiatives efficiently in their respective environments. Ultimately, persistent implementation of these digital tools and initiatives across the EU's healthcare system can drastically improve its quality through providing rich and accurate data trends for specific policy design, accelerate medical research, most importantly in the end, improve the patient's wellness. Thank you very much.